This is one of the most common broken bones orthopedic surgeons and emergency room doctors see. It happens in just about any sport where someone's shoulder is impacted, such as crashing a motorcycle or running into a wall. In sports with tackling and falling, these injuries are exceptionally common. Combat sports such as wrestling, mixed martial arts, judo, Brazilian jiu-jitsu, sambo are no exception. In this video, we are talking about clavicle fractures. The clavicle, sometimes called the collarbone, is a relatively small bone with a very important job. Of all broken bones, the clavicle counts for probably about 4% of them. Let's talk about it. I'm Dr. Lucius Pomerantz, board-certified orthopedic surgeon, and I see these and many other injuries in my clinic, and I get people back to their best function. Hopefully, this video will teach you the importance of the clavicle and how it contributes to the function of our arm, how it is broken, and how they are treated. For this video, important bones to understand are the clavicle, the collarbone, the sternum or breastbone, and the scapula or shoulder blade. The clavicle is an S-shaped strut that connects the arm to the rest of the skeleton. This connection is from the sternum to the scapula. The scapula's motion, which is very important for the overall function of the shoulder, it is very dependent on the connections with the clavicle through ligaments at parts of the scapula named the acromion and the coronoid. The clavicle also serves as an important area for muscle origins and insertions, which include the deltoid, trapezius, pectoralis, big muscles. As the arm elevates, the scapula also moves, sliding along the rib cage and tilting upwards. As the scapula rotates along the rib cage, the clavicle also rotates. The clavicle rotates over 40 degrees from when the arm is at the side to when it is fully elevated. If the clavicle is broken, the act of elevation causes the fracture to be twisted, and, well, that does not feel good. The deformity of a broken bone is influenced by the things that attach to that bone. The clavicle, the fragment that is furthest from the body, goes downward due to the weight of the arm and the pull of muscles, like the latissimus and the pectoralis. The fragment that is closest to the body goes upward due to the attachments of other muscles at the neck. As you can imagine, the connection of the arm to the skeleton is very important for the function of the arm and especially shoulder strength. When the clavicle is broken, arm function, especially overhead motion, is limited. Interestingly, there's a syndrome, cleidocranial dysplasia, where people, among a few other things, are born without normal clavicles. The Stranger Things actor Gaten Matarazzo has this syndrome. As mentioned, clavicle fractures are very common. Usually, it is the middle third of the bone that breaks, usually about 80% of the time. The lateral one-third, further towards the shoulder, is a little less than 20% of the fractures, and that leaves the medial one-third closer to the sternum as very rare. The lateral one-third fractures are notorious for not healing very well. Classically, clavicle fractures were treated without surgery. However, more recently, it has been noted that specific types of fractures are best treated with surgery. Surgery can best restore the biomechanics of the clavicle and therefore the biomechanics of the shoulder, and has more predictable bone healing. How orthopedic surgeons fix these bones can vary. The most common way is with a plate and screws. The plate and screws can be placed on top of the bone or in the front of the bone or both. There are also implants that go inside of the bone that can work very well but are less commonly used. Potential risks of the surgery include things like infection or a scar, numbness on the chest, and the theoretical risks of injuring very important structures deep to the clavicle, such as the lung, blood vessels, or nerves. Fortunately, the major complication rate for these surgeries is very low. Without surgery, it often takes 2 months just for the bone to heal, sometimes longer. With surgery, healing is usually a little bit quicker. That being said, most surgeons will place limitations to range of motion and lifting for at least 6 weeks after surgery, and it often takes 3 months to recover strength and range of motion, enough to return to sport normally. Then there is the debate of whether the plate should be removed once everything is healed, as sometimes the plate can cause irritation. It requires another surgery and more time to heal, as the bone is temporarily weaker for a period of time after the plate is removed. I usually tell people that you will get used to having the plate there and do not routinely take them out. Hopefully you all learned something. Learn how to fall. I'm Dr. Lucius Pomerantz. Let's keep moving.